Hello and welcome to the Healthcare India podcast. Every few years, India publishes what is arguably the world country's most important healthcare report. Many of you may not have heard of it, but it's called the National Family Health Survey or NFHS. Last couple of months ago, the government released the sixth version of it, and most people ideally see it as a public health report. But what hides within this report is a lot of insights that give us indications and signals to the future of healthcare in India. So I personally don't see it as a healthcare report, and nor should you. I also believe the NFHS is India's most comprehensive healthcare market intelligence report. Hidden within hundreds of pages of data are powerful signals. It gives us a sense of where the demand is growing, where investments will flow, how healthcare delivery will evolve, and what hospitals, entrepreneurs, investors, policymakers, what should they be preparing for? And if you are a healthcare entrepreneur, or you are somebody who's willing to invest in healthcare, what should you be looking for? Today, I'll share what are my 5 strategic insights from NFHS-6, which is the current version of this report. And I believe every healthcare leader should understand it, irrespective of where they are in the ecosystem. Because this report isn't about where India has been. This report is more about where India is going. So what is the most important signal that's coming out of this report? First, I don't know how many of us have kept listening to demographic dividend, but India is aging. India is becoming older, not younger. For decades, we've spoken about demographic dividend, and at least last 5 years, the narrative has been pretty significant, but it's slowly changing. According to NFHS 6, India's population below 15 years of age has fallen from 26.5% to 25.5%. That is about a 1% drop. While the population that is aging or aged 60 and above has increased from 11.8 to 12.9, almost a 1.1 percentage jump. As the years progress, this jump will increase. At first glance, it looks like a moderate shift. It's a moderate thing, 1% decrease, 1% increase. But this 1% is across a population of 1.4 billion people. What this represents is millions of additional elderly citizens seeking healthcare. This fundamentally changes the healthcare landscape, and that will continue to change as the years go by. Healthcare demand will now shift increasingly away from mother and child, maternal care, towards chronic disease management, conditions like cancer, cardiovascular diseases, neurological diseases like dementia, rehab, orthopedics, and long-term care. Healthcare systems built for acute illness, acute care will need to evolve into a system capable of managing lifetime conditions. So what's the strategic insight for a healthcare leader from here? This next decade will not be defined by who builds the biggest hospital. And that's my firm belief. It will be defined by who builds the best care continuum or continuum of care, taking care of an individual throughout their lifespan. Care providers should begin investing heavily today, if you ask me, in geriatrics, rehabilitation, healthcare, chronic disease management, and some kind of digital monitoring, including usage of AI. The aging of India has already begun. The second interesting point in this survey, NFHS 6 survey, is that India is finally getting ready for digital health. Digital health is a promise that has threatened us for many years. None of us has really seen the full fruits of its efforts. But today, there are enough statistics. Let me show you one that came out of this report. Women who have never used the internet increased from 64.3% to almost 77.3%, while internet usage among men shifted from 80.5% to 87.1%. What does this mean? This means for years, digital health companies, including many startups, argued that infrastructure and internet penetration had limited adoption. NFHS 6 suggests those barriers are rapidly disappearing. India is becoming more digitally ready for healthcare at scale. This opens enormous opportunities for areas like telemedicine, assisted care, remote patient monitoring, something we've discussed time and time again, digital therapeutics, virtual consultations, which became popular during COVID, but slowly ebbed out, and preventive health platforms. Technology is no longer a limiting factor. The key would be execution driven by process and human. Digital transformation, we have always discussed it. The strategic insight for leaders is it is not a technology play. We all know it. It's a strategy. It may amaze so far as to say it's a clinical strategy. Winners won't necessarily develop the most sophisticated technology. They will design digital experiences that clinicians trust and patients adopt. Technology alone won't transform healthcare workflow. The third interesting insight is that insurance is quietly reshaping the way we deliver care. Perhaps from a financial point of view, it is the most important statistic in this report. Households with at least one members covered under health insurance or financing increased from 41% to 60.2%. This is the first time that we've actually crossed the 50% barrier. This represents a very structural shift in the healthcare ecosystem. Insurance changes, it signals affordability, it signals provider behavior. It also signals the change that we've made. For example, hospitals investing in diagnostics, clinical pathways becoming more standardized, improvement in documentation, overall measurement of clinical outcomes, and healthcare delivery becoming more data-driven, more organized. Now, the insight for us, at least for healthcare leaders, is organizations must make reimbursement science, or the science of reimbursement, at scale. Otherwise, there will be a challenge. Today, we have mastered the art of healthcare delivery, but reimbursements and insurances still remains a big black hole. Future competitiveness of organizations will depend not only on clinical excellence, but on things like medical coding, ICD-10 coding, documentation, quality metrics, and measurable outcomes, which insurance providers have been demanding for a while. Insurance is changing the economics of healthcare. We may not go the US way, but we definitely won't remain where we are. The next signal is on continuous care, which is care continuum, and I discussed about it as part of my first insight. We are going to shift away from episodic care. India's healthcare burden is increasingly being driven by chronic diseases. Patients just don't suffer from one illness. They do bear the burden of conditions like diabetes, hypertension, obesity, cardiovascular diseases. A lot of these conditions span decades, if not years. Healthcare system designed around hospital visits or just one visit or one care for one episode are not sufficient. The future lies in continuous engagement. So hospitals will need to migrate, evolve, move from treating episodes of illness to managing care throughout a patient's lifetime. This requires monitoring, digital engagement, multidisciplinary teams. We've been talking about it for years, and predictive analytics. One insight for healthcare leaders is, how often do we interact with patients before they actually visit? And I'm not talking about Google ads or Facebook ads. I'm talking about real interaction. Answer to that question may determine your organization's relevance over the next decade. Healthcare is shifting from transactions to relationships. It's always been relationship driven. Remember the days of the family doctor. In between, we had this huge phase where we went episodic, more transactions. I think we are returning to relationships. And it has to be driven by relationships, which will require a better system, a better platform, more care continuum to come into the picture. The next signal is all around the value from buildings to platforms. Now, let me define this. Today, a lot of hospitals are being built, new bed facilities have been created. But the most hidden message under NFHS-6 is not about hospitals, it's about healthcare platforms. As India's population becomes older, more insured and digitally connected, value creation will increasingly come from organizations that coordinate care rather than simply deliver procedure. Here, there are huge opportunities in diagnostics, home health care, preventive medicine, women's health, mental health, elder care, and integrated care platform. Of course, a lot of this will be assisted by technology, including AI. So healthcare is evolving from an isolated institution to a connected ecosystem. The strategic insight here is, I'm not saying hospitals will disappear, don't get me wrong. Hospitals will remain essential. But the organization creating the greatest value, the hospital creating the greatest value, may increasingly own the patient relationship, clinical workflows, healthcare data, decision support system, rather than just a hospital building. The relationships that the hospital holds, that will differentiate one healthcare system to another. The future belongs to healthcare orchestrators, not just care providers. So before I close, I hate doing this because I thought everybody got the healthcare 2020 predictions wrong. But let me leave you with 3 predictions based on what I'm reading, and I rarely do this, but I get the sense that I have to talk about it. I think hospitals will go into the physical digital mode. Every major hospital chain in India will start operating a virtual hospital alongside a physical facility. Virtual hospital will look at things like remote monitoring, AI triage, virtual ICUs. The hospital of 2035, in the next, say, 9 to 10 years, will operate beyond its physical walls. Prediction 2, AI will continue to grow. And I feel, irrespective of the hype right now, which I think is not sustainable, but AI will become a very strong support system to the clinicians. What is happening in radiology is only the beginning. AI will soon support pathology, cardiology, oncology, but clinicians will never be replaced, but they'll become more predictive. I see that happening. Clinicians will be able to take on more workload of clinical cases while AI supports them with all the administrative ones. Prediction 3 is the most valuable healthcare companies may not even own hospitals. Instead, they will own platforms that coordinate care, integrate clinical intelligence, manage patient journeys. Healthcare will increasingly resemble, I would say, fintech, where the value comes from orchestrating an ecosystem rather than delivering the service directly. As I conclude this episode, if I had to summarize the NFHS-6 in one sentence, it would be India simply isn't becoming healthier, which is true. India is becoming healthier. But India is also becoming a completely different healthcare system. It is older, more connected, more insured, more digitally enabled, and increasingly focused on managing health rather than simply treating disease. For healthcare leaders, entrepreneurs, innovators, investors, policymakers, NFHS 6 is not a report about yesterday. It's a strategic roadmap for the next decade. The question is not whether these demographic shifts will shape Indian healthcare. The question is whether your organization is preparing for them today. Before you move on to your next meeting, your next WhatsApp message, your next email, your next task, just ask yourself one question. Which one of these 5 demographic shifts is most likely to reshape my organization over the next 5 years? And what am I doing individually, personally, to prepare for it? I'd love to hear your perspective. Thank you for watching and listening to Healthcare India podcast. If you found this valuable, please do subscribe, share it with your colleagues, join the conversation. The future of Indian healthcare will be shaped by the decisions we make today. Thank you, and have a great rest of the day.